Hello, friends. Happy weekend. You're getting casual Jasmine vibes today. It is Sunday over here. If you're just catching this and you are live, let me know that you are here. I'm excited about today's conversation. I'm always getting a lot of questions about how to get into medical billing, how to find the right positions, all the different job searching techniques that really work. And so today it's going to be like an all-inclusive. If you're breaking into medical billing right now, what do I suggest? What do I recommend? We've have a compilation of other content here on the channel that covers this a little bit, but today is going to be kind of all inclusive, and then we're going to, kind of hopefully pull things together for you so that you can have a full action plan to get started today. So let me know that you're here. Oh, I see Dorothy's here. Hi, Dorothy. Thanks for being here. I'm excited that you're here. Okay, friends, I am running solo today, so I'm going to be driving the system here while also talking to you. So bear with me if you end up seeing some things or like not seeing something. So let me know if there's ever a moment that you cannot hear me or see me because I don't have anybody in the back letting me know about that. So you are my green room today. We'll say you guys are the ones in the control room. Actually, that's what the control room today. So BC, hello. It's so great to see you. It's been a while. Yeah, happy weekend. I hope you guys are having a really lovely weekend. I am shifting from this to a more fun meeting after this. So I am wearing my casual fun meeting attire already. So yeah, hi. Okay, let me know when you guys get here. Just keep saying hello. I am going to get us into the content because we have a lot to cover today. And so I do want you to know there are going to be 3 different sections of today's conversation where I'll open up for Q&A. And so just go ahead and put your questions in the chat, and then I'll scroll back to look at those questions. So hi, Deidre. Hello, Molotype. Hello. Great to see you guys. Thank you so much for being here. Awesome. Yeah, keep saying hello to each other and definitely feel the freedom to connect. The whole idea is that we get to do this live together. This is a live recording. So if for some reason you cannot watch or listen to the entire recording, the entire, webinar, it will be recorded and it will be available still on the YouTube channel. And then we're also going to make it available on our side. And then bonus for my folks who are members of any level, both YouTube members and Inlera U members, you guys will have access to the action plan completely for free. And so please know that that is available or will be available tomorrow. So we'll have to finish downloading the webinar, and then we usually upload those 2 things together. So, all right, with that said, we're talking breaking into medical billing. So thanks so much for being here. Let's get this party started. If you're new here, hello. If you're just kind of stumbled across this information and are have no idea who I am and are curious because, it says you talk healthcare, but you look like this really cool person because I am a cool person. But this is Inlera University. In this space, we are committed to alleviating the stress and confusion in the business of healthcare. My name is Jasmine Vializ, and in this space, our kind of intention is really to give you guys the full real story about what it's like to be in healthcare, in the business of healthcare, so the back end of healthcare. I have over 25 years, now it's going into 26 years of experience, or over 26 years now of experience in healthcare. And I did start in a medical practice and then moved into medical practice, as a receptionist and marketing support team member. And then I moved into doing some assistant work and then moved into doing billing assistant work and then became the medical biller and then the practice manager, and the rest is history. But I have had a revenue cycle management company for about 20 years now. And that company has shifted to provide training and consulting to my folks who are looking to get in healthcare. So that is what I do here in the YouTube world. And then outside of YouTube world, we have other kinds of coaching groups and things that take place. And so I'm excited that you're here if you're here for the first time. All right, my friends. So we have a busy webinar to tend to today. I'm going to make this a little bit bigger so that y'all can see it. Let's see. There we go. All right, so we're going to go through the agenda really quickly. So first topic today is going to be really just the landscape. So I want you to understand what exactly takes place in the world of healthcare, specifically through the lens of medical billing, right? So we've covered in recent webinars, getting in through the lens of revenue cycle, of a medical office receptionist, and then looking at things from being a billing company owner. Those are some of the recent webinars that we've done. But today, we are specifically looking at through the lens of medical billing. And so what does that look like? Who are medical billers? Where can we find them? What's the difference between all the things that everybody always gets confused about? Then we're going to go into the keys. So the key to success and getting yourself to open the door to the world of medical billing. So really, yes, it's going to include things like education, training, what the skills are, what tools and resources do you need, and then really what are the differences in between, or really the kind of positives and negatives, pros and cons between you doing freelance work versus working as an employee at someone's billing company or practice. All right. Lastly, we're going to get into the action plan. So that is where we're going to really dive deep into making sure you understand the ways that you can position yourself successfully to be attractive to employers. Also to just be prepared, right? What are things that maybe you're missing? So we're going to go over some of the myths, some of the mistakes that people make, and misunderstandings really of how this world really works. Okay? The landscape. So in the landscape, we're talking about the bird's eye view. Let's zoom out for a moment. What is medical billing? Medical billing is the process of translating healthcare services and claims into invoices that ensures payment from insurance companies and patients. So we're responsible for both the insurance carriers and any liabilities owed from patients. It involves things like coding, sometimes submitting claims, managing reimbursements, and making sure that denials are processed and resolved so that our healthcare revenue cycle can run smoothly. What's the role of a medical biller? Really, the role of a medical biller is to manage the stages of the billing process. So when we say medical billing, the medical biller is the one who is making sure that all of the medical billing processes are happening timely. And then, of course, that the practice is being reimbursed adequately for the services that they're providing. Okay, so we cannot talk medical billing without mentioning the revenue cycle. So the revenue cycle is the full process. Sorry, that thing is popping at us a lot. it's still jumping. I thought it was going to stop. The full process of the way that money moves through the healthcare industry. So in the United States, we have what's called the healthcare revenue cycle. And essentially, it's when the patient is first, it says scheduled, but really when they get referred to a practice, that practice then sees the patient, or they schedule the appointment, the patient visit happens, claim happens, all the way through the patient potentially having a bill. And then maybe the process restarts if the patient needs to come back to the practice. Another visit takes place, and that visit then goes through claim submission and so on and so forth. So it literally is a very cyclical nature. And in the US, it's very important to know that when we talk medical billing, we are really speaking about the medical biller being instrumental in this process of the revenue cycle. Okay. And so now I know you're going to ask, then what is the difference between medical billing and revenue cycle? So I don't want to go super deep about these differences in today. I'm going to just say that one is a part of the other. So medical billing really is a part of revenue cycle management. And in this video, and if you are going to download the slides from this presentation, they get loaded to membership platform. And so it will have the slides, and you can have a clickable link here. It's on the channel. So if you're looking for a more detailed explanation, this link right here for medical billing, this video right here for medical billing versus revenue cycle management is like maybe, 5 minutes or so. And it'll get you a really quick explanation about those two and really understanding where medical billing fits into the revenue cycle as a whole. So then the next question that we always get is medical billing the same as medical coding? Let's have this conversation. So I really like to dispel these misconceptions, because when we first started in healthcare, we had a lot of, when we first started, medical billing in healthcare, we had a lot of folks kind of preparing us to learn the process of medical billing and coding. And I say this because I've been in for a very long time, right? Early 2000s. We didn't start formally submitting claims till like 1996, just so you guys wrap your heads around this, okay? So I was kind of at the early stages of when claims were formalized. When I first started, there were still some claims that were handwritten, signed by patients, and actually sent to the insurance company only by mail, and an adjuster, like a human at the insurance companies, would review the claim. That has since very much changed, but because of that, they were trying to help us understand how to use this fairly simplified code set, and how do we make sure these claims get processed. But if we didn't know the codes, we would then just put what we would say miscellaneous, or there's no code for that, or we didn't think there was a code for that, and we would explain what was done on the claim. All right, that has since gotten way more complex. We've added a ton more codes, like a ton more codes, both on the diagnosis side and the procedure side. So for that reason, they have separated. We have separated the medical coding and the medical billing, and that has happened over the course of the last couple of decades because of the complexity and because of the nature of the coding. The coding is now a support for medical providers. Yes, they have existed since the beginning. Coders have existed since the beginning of the code sets release. However, a lot of medical providers at that time were trying to learn the code so that they could do their own coding, okay? So it is a little different because now that it's gotten so complex, the providers don't have the time, the capacity for that, okay? So let's just back up from this a little bit too, just to explain. I hope you understand why they're not exactly the same thing, but medical coding is the way, they're both translation, right? Medical coding, we're translating documented care, so what was done with the patient by the providers, into billable codes. And then medical billing, we are taking those codes, sending them to insurance, and hopefully translating those codes into payment. Okay, so those are really the differences between the two. And we, like I said, have really worked hard to make sure that there's designations between the two roles because of the expertise needed for coding and the expertise needing for billing. Both need to be developed differently. And truly, if you are in a practice that has more than one or two procedure codes being used, it is quite complex trying to be the medical coder, full medical coder. When I say that, you are interpreting documents and actually selecting codes to represent that patient's care, and also be the medical biller and be effective, okay? I want to know what questions you guys have as we move along, so feel free to ask questions throughout this time together, because it's very important to me that you guys understand the differences between these things before we dive deeper. Okay, so here's the deal, is that though we have a lot of specialties in healthcare, we have a ton of specialties in healthcare, right? And you might already know the ones that you like. There really are only two different kinds of medical billing. There's either institutional medical billing or professional medical billing, okay? So what does that mean? Institutional are things like our hospitals, our skilled nursing facilities, rehab centers, and they're billing services like anesthesia, hospital admissions, and emergency room and lab testing, all right? That is for institutional or facility billing, is sometimes said in that way as well. Then we have our professional billing. So professional billing are things that providers are sending. Providers, nurses, therapists, things that are happening outside of the hospital setting. And this is when we hear typically medical practice billing, we're talking about professional services, okay? For these two different types of billing, there are two different claim forms that are used. You may not be aware of this. So we have two different types of claims forms used, and both electronically and on paper. So when I say claim forms used, yes, this is the physical form, but electronically, there is a different version that's used as well. So if you notice down at the bottom, I say that for the institutional claims here on the left, this institutional claim has a CMS 1450 form, which is the physical form that's on the screen. And then electronically, they are submitting a format that is called an 837I. And that 837I, excuse me, represents institutional, okay? It represents the word institutional. Then we have over here our professional services claim. So our professional claim is titled CMS 1500 form, and that is our 837, can you guess? P for professional, right? That part's not very complex. I'm glad they make it easy for us. So the 837, I'm not going to go in super detail about what that is, but basically know that it is the electronic format of the way that we send our claims. That's just the name for the way that we send our claims when they go electronically. And when they go electronically, it's not like we're emailing them. They go in a specific format that makes it possible for the insurance company to receive them without having to do things like OCR, which is that optical character reading, meaning if you send something by scan, they are actually trying to read that document. That doesn't happen when we send in our electronic format. They actually take the information and ingest it directly into their system when formatted properly. So the 837I and 837P will go directly to the insurance company without needing to have any sort of translation happening within either our system or their system. All right. So questions? Okay, so here we go. This is the deal. I have to be totally real with you guys. Not everybody is built for medical billing, okay? I feel like it's sold to the public as though it's such an easy thing and you can work from home and it's so wonderful and all you have to do is, and then insert whatever thing they want you to buy. I'm going to be frank, I don't believe that medical billing is for everyone. And I think it's really important to know that there are a lot of other places in healthcare where you could fit in if medical billing is not for you. And sometimes you get a taste of it, like today, when we get into this discussion around what a medical biller's day looks like, maybe you recognize where, ooh, I really don't like what Jasmine's talking about. Then you have all these other places in healthcare administration where you could potentially plug in. So know that if we go through these questions today and you're like, ooh, there is no way that I want to get into that world, plenty of other opportunities for you. So don't get sad about be disappointed, I should say, about not being able to fit in the role of medical biller. It's not for everybody, okay? So do you have attention to detail? Do you enjoy investigating? These are questions I want you to be asking yourself and be honest, not like, well, sometimes, like honest about most of the time. Is your answer a yes to these questions? Because if not, trust me, you will be unhappy in the world of medical billing because these questions relate directly to the work that we have to do. All right. Do you enjoy organizing information? Do you have great communication skills, both in writing and on paper, in writing and by voice, by phone, in person? All right. Do you have a love of learning? Are you comfortable with technology? Very important, very important. Do you enjoy variability in your workday? When I say variability, I mean things changing quite a bit. So you're not doing the same thing all day, most days in medical billing. Do you question most things? That kind of goes back to investigation. Like, are you always trying to poke holes in things? Do you love finding solutions? Everything about medical billing is problem solving. So important to know that. Do you like to argue your point? If you don't like to argue your point, then you will not like, or standing up for something when you know something is wrong. If you don't enjoy that, you will not like medical billing, because a lot of what we have to do is to fight the insurance carriers representing our information that we have. So we're trying to kind of gather a case to make sure they understand why a claim should be reimbursed, okay? Are you ethical and trustworthy? Very important, very important. I'm not going to say anything else. Ethical and trustworthy. Can you stay patient and persistent? This is the deal, is sometimes in medical billing, you work on something and you spent hours preparing this case to get a claim paid, and it does not get reimbursed. It's very disappointing. It can be very disappointing. And so you have to be persistent. You have to be willing to kind of, let me see what they said. Let me try to figure out what happened, okay? Can you focus on repetitive tasks without losing accuracy? So there are some things that you have to do that are somewhat repetitive, such as payment posting or charge posting, right? And you must try to have the highest level of accuracy possible. Do you have great customer service? So that kind of goes to communication. But yes, customer service is necessary in medical billing. It is necessary for you to make sure you're able to address issues patients have, but also when you're dealing with your counterparts, people maybe in other departments, the medical coders, the providers. That is a level of customer service. So hello, friends. I haven't seen you guys in a long time. Blue Butterfly, Latoya, great to see you guys. Thanks for being here. Dorothy says, check, check, check. Love that. Good. I'm glad that you're doing this. You make sure you go through and ask yourselves these questions. Okay. Industry demand for billers. I don't want to bore you guys with a lot of information related to this, but yes, there's a ton. Healthcare is expanding at a fast rate. Medical billing is expanding with it because it gets messier, busier, and they need more support. And yes, when people ask this question about AI and whether AI is going to take over, the deal is that we are leveraging tools, well, not all, but some practices, some software, some hospital systems are leveraging tools that are supporting, say, the organizing process, but the actual work queues and the work as it needs to be done to kind of fight the claims and research and identify things that were not done correctly. All of that effort is still necessary, done by a human, because of, again, the variability and the level of complexity that exists in healthcare. It is not, even though we have code sets that represent codes, there really is not an ability for a software to be programmed to satisfy the complexity yet. And I don't want to get into detail there, but just know that AI is not something that us as medical billers should be concerned about. We actually should be looking at leveraging. This goes for all areas of healthcare administration, looking at ways to leverage the tools that are out there. All right. Okay, so what titles are you looking for? So here's some of the titles that are very common, even though we've talked about medical billing and medical billers, there are other terms used for jobs that are medical billing jobs, all right? So medical billing specialist, revenue cycle specialist, medical biller, billing and coding analyst, claims processor, medical billing manager, and then freelance medical biller. That's supposed to be 2 words down there at the bottom. I'm gonna sip of water. Okay. All right, so these are jobs that you're going to be looking for when you go job searching. Let's talk about the typical day of a medical biller. So this is a typical, duties of a medical biller. So typically handling things that are charge related, coordination of efforts, so coordinating with many people in the practice, and there's just administrative and financial stuff. So making sure that we have the right documents in place and the documents are sent. So that's just talking about claims, and the way that we speak to our patients and others about what is going on with the patient's account. Then we have things like payment management. So making sure payments come in and they get applied to the right place. And that's not just from insurances. That does include things like patient payments when they come in, whether by front desk. If you have to be the one to apply a payment, that means make sure it goes to the right service. And then you might also be the one responsible for things like payments that come in by mail or through an external system from patients as well. All right. Then account management. So you're going to be the one that's following up on claims, account maintenance, following up on claims, making sure that your patient accounts and reports are clear and that you can interpret them. All right. So that's just a high level view of the typical things that a medical biller does. What questions do we have? What questions do we have? I'm going to get into some more specifics around what a biller's day looks like and all that, but I want to make sure up to this point, do we have questions? No? All right. If you have questions, feel free to put them in. We have 2 more stops for questions along the way. Okay, so breaking into medical billing, specifically medical billing in the world of healthcare, is slightly different than what we have talked about through what we've walked through some recent webinars with medical office reception if you haven't been present. And so first I want to talk about, do you need a certification? So a lot of folks ask this question. The truth is, no, you do not need a certification to be a biller. As a matter of fact, there are a ton of billers that have been in billing for years and years and never even thought about getting a certification. And I was one who had not only was a medical biller for a practice and a practice manager for a practice, and then started my own billing company all before I decided to get a certification. All right. I did choose to get a certification And at that time, there was no such thing as a medical billing alone certification. It was only medical coding, actually, medical coding and billing, but it was mostly medical coding because the nuances of the billing process were still kind of being fleshed out. But the medical coding, the medical billing wasn't necessarily something that I needed confidence in because I've been doing it for a while and I learned it. I did learn it on the job. I trained myself. I also learned things and brought those things into the department that I was running. And then I also learned some medical coding, but when I started my own company, that was when I decided I'm going to go get a medical billing and coding certification so I can just really test my skills. And that is oftentimes what I suggest for my folks who are in the world of medical billing and you've kind of stumbled into it, which happens to a lot of us. If you started in the world of medical billing a little bit informally and you didn't go through training process or anything that more than somebody kind of halfway training you on the job, which happens to us. I do think that going out and getting yourself a certification or at least sitting for a practice test can really help boost your confidence in the knowledge that you have, because sometimes we don't know for sure what we know. We're nervous about whether or not what we know is real and true. All right. So there are some positions that you will be required to have a certification. So it is important to know that some positions are going to say you're required to have a certification, and some might even require you to have a degree, especially if you are going into a management level. Okay. Here's the deal. Certification. I forgot about the slide. So certification is helpful when you're new to the field and you want to stand out for employers. If you want to increase your potential for raises and other adjustments to pay, bonuses, things like that, if you plan to specialize in specific areas and hospital settings and healthcare government organizations, the deal, government healthcare programs, the deal is that in hospital settings, as well as some of the government agencies, they do have requirements for, this is just when they define their roles, they say, we need to have this certification, this needs to have this degree. That's just a part of the way that they create their job profiles. So it's important to know that you might find that represented. If you're considering freelancing or starting a medical billing business, it could help you stand out. And I say that like if you are in a specialty that you want to be represented for and you want people to know that you have that expertise, or you would yourself want to know that you've covered all your bases on the knowledge front, then it can help you to get certified. Here's some popular certifications. CPB is a very popular one. I have a CPB. CPB stands for Certified Professional Biller. That is from the AAPC. Then you have CMRS, that's a Certified Medical Reimbursement Specialist. That's from AMBA, so the American Medical Billers Association. Then we have our CBCS. This one is not as common, but it is an online only certification. I don't have many things to say about NAHA except for the fact that they don't have as much structure as an association as the other two that I had just mentioned, which means that they may not offer a lot of additional value for you if you're looking to get connected to networks. And we're going to talk about that later. All right. Sorry, guys. I had coffee earlier, so it's making me very thirsty. Okay. Can you get a job without a certification? I've answered this already, but just to go over, yes, a lot of companies will hire even entry-level billers and train them on the job, especially smaller practices and billing companies, because of the cost associated with someone who has a lot of experience and a lot of certifications. And so some of the smaller billing companies, as well as smaller practices, have a reduced budget, and it requires them to look at developing. And then personally, I'll tell you guys this, personally in my company for many years preferred to allow our folks who were hungry and excited to break into healthcare opportunities, not just because I like to train. However, the other thing is sometimes when you bring someone into a practice that has a lot of experience, you can sometimes find that those individuals come with a lot of ego. They think they know everything. And they oftentimes can come with a lot of bad habits that are hard to break. And so, truth be told, many of us hiring managers are actually looking for people that are clean slates, that are hungry, excited, and willing to learn. We talked about those questions earlier. Make sure you refer back to those questions because that's vital to know that someone is evaluating your willingness to develop and learn new information. Because if you're not willing to, then highly unlikely to have that be a successful process for someone trying to train you. All right. And Latoya says, yeah, you're so right. It's real. Most of us don't like teaching folks from scratch. It's not fun. It's not fun. Oh, you know what I just realized, you guys? I need to change one thing that might impact. This is what happens when I do things by myself because then I don't remember. Let me take that. There we go. Okay, I got to take that thing off. Otherwise, it might cause issues. Actually, maybe not. Yeah, maybe it won't because it looks like it's adjusted. All right, cool. Thank you, platform. Okay. All right, so technical skills. We're going to go into technical skills and then we'll talk about soft skills next. So what really makes a successful biller? Someone who has, this is all technically related, so things that you might have to develop, right? Skills for around medical billing and coding knowledge, claims processing and insurance rules, because it's a little different when we talk about someone being familiar with billing one payer versus multiple payers. So let's say you've worked for a practice that only works with Medicaid or Medicare. We'll say that's even better example. They only bill Medicare services or something specific like only DME Medicare services. That's different than a different type of practice that has experience billing multiple insurances. So insurance rules and variability there is helpful. Knowledge in EHR systems as well as billing software. So the reason why for EHR systems is like sometimes we have to get into the documentation if that's permitted, and we need to know how to navigate. I want you to know how to identify a visit record, how to identify exams and other laboratory results and things like that, because you just got to be comfortable. You just got to know how to navigate if you're going to be getting information, gathering information to again build your case. I want you to be clear of healthcare regulations. So things like HIPAA, different types of policies that come from different agencies as well as insurance carriers, because every carrier has their own different set of rules. So you don't have to have them all memorized. What I want you to know is how to navigate and find those things, all right? You have to be, again, research oriented, someone who enjoys investigating, and someone who is able to organize information, okay? Because once you learn something, if you learn something about an insurance carrier, it's very, very helpful for you to go ahead and start to, I was reading a comment. Sorry, I lost my thought. I want you to go ahead. This is why I have to hide the comments because I can't not look at them. All right. So I want you to go ahead and start to organize documents that like help you recall, I should say, that information without you having to remember it, right? So you're going to organize yourself and start to store this information as you learn it so that you build yourself some resources that you can refer back to. All right, data entry and accuracy, so important. I can't speak to the importance of data entry and accuracy more, is that like everything that we do in the world of medical billing has to do with the integrity of the data, right? So like if we're in there and we're making changes to balances and making changes to payments and things like that, we are literally the ones who are in control of whether or not that claims is outstanding and that's $1,000 that's owed to the practice, or if the practice has eliminated the value of $1,000. I don't want to use a lot of technical language today, but basically it's like I can get in there and I can actually manipulate that information and misrepresent what's owed to the practice, or I can be advocating and making sure that I'm doing a great job to fight for what is due to the practice. So that is where all of the levels of integrity come into play. I said that earlier about being ethical and all of those things. There's lots to say about that. I want to go down that path. That'll be a separate conversation entirely, but a really important one. All right, accounts receivables and collections. So making sure that all of our patients' balances are resolved. It's really important even just to understand what your function is as a biller, and always resetting back to that, because sometimes we can get bogged down by the kind of minutia of what we're doing in the moment, that we aren't focused on the bigger picture of what is our function in the practice. So very important. Medical terminology anatomy absolutely can help you, especially if you are the one who is either selecting the codes, like the one who is identifying what codes are appropriate based on documentation, or let's say you're the one who is correcting or noticing when corrections need to be made, right? So you just being familiar, again, when you're doing your research, looking at the documentation, looking at the claim, you then might be the one to refer back to your coder and say, hey, this doesn't look right. Or, hey, doc, if it's going back to the provider, this doesn't look correct. Can you please can you please review it? Okay. Basic math and financial skills. So the deal is we don't do a lot of math. A lot of people get worried. Yes, there are numbers, and there are a lot of numbers. And we are sometimes looking at messy ledgers that are not very well designed, to be frank. But there are numbers. So if you're intimidated by that or get dizzy looking at things like spreadsheets with a lot of numbers, medical billing may not be for you. I should probably add that to those questions because yes, there are a lot of numbers. They aren't necessarily things that you're going to be doing math with. You're just referring to those numbers because we've got code sets that are made mostly numeric. And then we have balances, obviously, that are numeric. We have payments going in, adjustments out. All these things are numbers representing the information. So if you get dyslexia with numbers specifically, it could be a challenge for you. Soft skills. We talked about this kind of like asking our questions about ourselves. And so I'm just going to speak high level. Do you have attention to detail? Organizational skills, problem-solving abilities, communication skills, patience and persistence, ethical and confidential, right? All we're pointing back. Time management, so important. Customer service skills. So these are all soft skills, things that are transferable, right? So if you've done things in other industries, you could probably move that information over to what you do in healthcare. All right. Where do our billers work? Lots of different places, and you may not know this, all right? Obviously, healthcare, hospital systems and healthcare systems, large and small, that have really big billing operations in-house. That's one place. Private practices, that's our typical medical practices. Medical billing companies, very important to know this. Insurance companies, yes, insurance companies do hire medical billers. Sometimes they hire them to review the claims. We have someone in our community who pops in from time to time who actually works for an insurance company and one of the big five, and it's on the medical claims processing side. And so sometimes they're reviewing claims that were processed, kind of like old school medical adjusters, but think about it more of like, we'll say, like an auditing capacity. Okay. Then we've got our government agencies and healthcare, government and public agencies. We actually have someone else in our community who works for Medicaid, or their state Medicaid. So it is it's helpful to know that medical billers are found in these on the other side, we'll say, of healthcare. We think about what happens in the practice or the institutional side, but you got to think about the other side of healthcare where they hire medical billers as well to do things that support the processes in their organizations. And then home. You can work from home. If you did not know that, yes, I am in my home. People are always curious, is it actually my home behind me? Yes, that's my home. There's a little altar for my kitty cat who passed away. Those of you who's been around long enough might remember her. And so, yeah, there is a lot of medical billers who work from home. It is not always something that we can do right away, but it is something that's possible, and it depends on the organization that you're working for. All right, here's a sample workday. I'm not going to go through all of this. I will give you guys access to slides, but here's just a potential flow for our medical billers as they move through their day. This is what we would call someone who is working a role as an end-to-end medical biller, which means they are the ones who are handling charge entry all the way through to claim reconciliation and patient billing. Okay. And so this would be an end-to-end medical biller. It's a little different if you're working for larger organizations that might have you kind of semi-siloed, which means that you might be working in one specific area. Like there are hospital-sized medical billing departments where the team There's an entire team of people who only work on a work queue from one of the big five, like from Aetna denials, right? All they do all day is work denials from Aetna. Maybe it's even for a specific set of codes. So if you don't, I mean, there's still some variability in those days, trust me. But if you don't like the idea of kind of doing all of these functions in a practice, you might want to be looking to be hired at a larger organization. All right, so I know that you guys want to know, if you're new to billing, what happens in the software. I'm not going to go over that in here. We do have a video where I walk through medical billing from within a software. It will take us a long time to do something like that together, and it is a little bit of a distraction from what I'm trying to help you with, which is actually trying to break into the field of healthcare. But totally check that out. Again, if you have the slides, this link that you hover over here and the actual video. But if you go to our channel and you can search, what does a medical biller do? Or you can type in the YouTube search box, just what does a medical biller do, and put Inlera in there, it should come up and that's the thumbnail. So you can it'll jump out to you faster. All right, I know you guys want to know this. How much can you expect to make? This is based on research. All right, I am going to tell you this, that there is literally no way that I can tell you the exact amount that you should be demanding or asking for. Know that if you are breaking into an industry and you're new, you're probably going to look at the very low end to the numbers that's here. So the national averages, and they got to keep this in mind, these are averages. So this goes to big cities, small towns. This is somewhere in the middle, okay? They're saying that both Indeed says $20, ZipRecruiter says $18 for certified. Keep that in mind, which is interesting. Then that translates to annual salary, 41 to 48. Again, this is related to potential certification versus someone who is just starting. And these are also averages. So we might have in some areas, like I know for a fact in some areas they're starting about 65 to 70,000 for billers, and other areas like that would be absurd. They're starting at like 38, right? So you have to recognize that where you are. These are things that are influencing experience, like we talked about. If you're brand new, please don't jump to the highest level. Certifications matter. They do make a difference. Not in all places though. Okay, so I'll have to make sure that you're clear about that. Not all, I think I mentioned this briefly about hospital systems requiring certifications may not have a bearing on whether or not you get more money per se. It just means that's what they require, the basics of what they require, right? Then you have the possibility of our organizations that will incentivize you for actually getting certifications. Means they actually pay you more, right? So there are organizations that have that kind of HR structure, and there are a lot of others who do not, okay? Work environment makes a difference. So we talked about this, size of the organization. If you're working for a private organization versus one that is much larger in public. If you're working for a billing company, both small and large, and I say billing company, but I also mean things like revenue cycle management companies or folks that make that distinction in their name. All right. So overall averages are saying between $18 and $23 an hour. That's like one of the highest they're saying. Now that you can absolutely see yourself go higher if you take on a supervisorial role, meaning you're overseeing somebody else or people in your department. As well as if you find yourself getting specialized certifications that also include things like auditing, okay? Salaries that translating to 38 to 50,000, depending, of course, on these things that I mentioned. All right, I am not going to review this whole thing, but this is our freelancing versus employment. So the deal is that I know that many of you are wondering, what is it like to actually be a medical biller versus for someone working for someone versus a medical biller working for yourself? These are the things I want you to be thinking about. I'll leave it on the screen for another moment or so. As I said, the slides will be available, as well as the action plan and all of those things on the Inlera U side tomorrow. If you are a member of Inlera University, it'll be available, as well as if you are a member of the YouTube channel. I might play around with making everything totally available for everybody for 2 weeks. We've done that before, and that was helpful, just so we don't get as many messages from people about the information. So yes, we'll do it for 2 weeks, and then I'm going to drop it back to the perks for our members, because that's what we promised for our members. So, all right, freelancing and employment comparison is on the screen. You can hit pause if you'd like. I'm going to skip it. Okay, Q&A. I saw a question come through. So yeah, here we go. So Dorothy, great question here. So NHA, I can't always say that one. This doesn't really like roll off the tongue very easily. Took that program and I learned it's not accepted. I didn't pursue the certification. Yeah, it's true. So unfortunately, so here's the deal, is the most recognized are the first two, which is the CPB and the CMRS, which is from the AAPC and the AMBA. And it depends on where you're wanting to work, because if you know you want to be at like your local hospital, then please go to their website and see what the requirements are. They should have in their listings, on their job listings, the exact certification requirements, and like if there are specific ones, or if there's like a minimum type of certification that they want to see that you have for certain roles. All right, so very, very important. Thank you so much for mentioning that, because that is important. We get questions about the NHA one a lot, and like my favorite thing is to pick certifications that you can put after your name where it stands out very easily. And those two, the first two, are ones that most employers, if they're hiring for billers, they know without a doubt. So they see it after your name, it automatically kind of jumps you to the top of the list, which is much better. All right, good questions. Oh, you're welcome, Blue Butterfly. So good to see you. Okay, I've heard that, including from one of your videos. Yeah. There is. A lot. There is a long wait time. So here's the deal, is that we aren't always calling on all claims. So it's important to say that. But when we do call, yes, there are oftentimes long wait times. And it's really important that if you're going to sit on the call, you try to call from sit on the phone, you try to call for more than one claim at a time. So you want to call for multiple. But now some insurance carriers have actually given us limits on the number of claims we can ask for or ask about, which is even more of a pain. So you might sit on the phone for 30 minutes or an hour, and then you are asking for 4 claims, or for 4 patients or whatever. It depends on what you're calling about or what types of claims and things like that. So yes, it's important to know it can include long hold time. The deal is, because of medical billing being so variable, we are oftentimes doing other things. So it's not like we're sitting on the phone and watching a soap opera or something. Is that even a term that people use anymore? I should say Netflix, because I think soap opera like ages me for sure. And so I am of the age where soap operas were a very real thing and were recorded on VHS most of my younger years. Okay. The people always wonder, how old is she? Okay. So, you action plan. You are the action plan. The R is missing. So your action plan. So the action plan. Let's get into this. This is going to go through a lot of lists. So prepare yourselves. And I do want you, again, to know that having your hands on the slides is going to be great. And there is a more structured, as I said, the actual action plan is a structured document that has like worksheet style areas for you to fill out. And my friends, actually, I should mention this. If you have not been watching recent videos, or if you have not gotten to our site for memberships, looking into memberships, we have what are called show notes for all of our videos now, which basically means that anything that we produce, we have something that is documenting in really key takeaways and information, and also action steps and some kind of actionable worksheets, such as things that go along with our book clubs. All of those have show notes that are worksheets. And so I say all of that to say that with this video, it is an actionable worksheet that is coming along with it. So, it is actually cutting off one little thing here. It just says freelance work at the bottom corner. All right, so what are the tools you need to get started? Reliable computer, dual monitors. And I say that, yes, it is not required to have dual monitors. However, you will be way more efficient and effective. And as a hiring manager for many, many moons, I do not allow my team to operate without dual monitors. It wastes a lot of money, time, all the things. Because right now, for example, I am talking to you. That's why you see me looking back and forth. I have multiple monitors. And what I have on my screen, and I'm not even moving around information, I need to see more than one screen. Now, when you're working in the field of healthcare, specifically medical billing, we are oftentimes needing to be in an insurance company website, in our software, and sometimes having a document open on the other side and the medical note on this side. So I know some billers that have 4 screens. I've had 3. That was the max that I've had. I would recommend that do not try to start billing with a laptop. It's inefficient. You can have a laptop, I should say this correction, but get what's called a docking station for your laptop, which is something for you to plug into that then lets you connect monitors to it. All right. So you need to have the right resources if you want to be effective. The whole idea in this space is that we are trying to help you be more supportive for our practices so that they can focus on their patients, right? So I will never advocate for you to just halfway do something. So please don't start with a laptop or without dual monitors, I should say that. You can start with a laptop, have a docking station. Okay, high-speed internet. You need internet for all things. That's all I'm going to say. Printer and a scanner. This is not required for all because some companies do not allow you to print. So it's important to say that, but it might be helpful if you are the one who is, well, definitely if you're in practice, but if you're working from home and you are the one who is mailing those appeal letters or claims, you might need this information. Okay. Yep. This information, this resource. And then external hard drive or cloud storage for backup. Again, if you are a contractor, a freelancer, someone who is storing information on your side, you need to make sure that you have secure backups of the information that you're creating. So let's say you're creating appeal letters and other things for your clients that or billing departments or billing teams that you're serving on. You must be able to maintain those records, and hopefully you're giving them access at some point back to that information, or it's going somewhere else. But in the interim, if you have it in your system, please don't just have it sitting in your computer. Easy way for you to lose everything and cause yourself lots of stress and frustration. All right. Okay. Where was I? Oh, HIPAA compliant email. I put Google Workspace. If you guys don't know this, Google does have a HIPAA compliant email structure where you have to pay for it. It is the paid version of Google. So please don't just go out and get Google and be like, Jasmine said. No, it's got to be the paid version, and you need to make sure that you have the right level. And I say that because I don't know how long these videos are going on right now. All of them have, I believe, but who knows? People change rules. Make sure you have the one that actually says it is HIPAA compliant and those standards. And how do you know that too? That Google actually executes a BAA with you. All right. Some of the more things may be required if you want to do freelance work and if you want to start your medical billing company, for sure. Many more things are required. All right, so here we go. Find the job. There's a lot of things that we have talked about related to this. This link here, my friends who get the slides, this link here takes you to some YouTube videos. We have a playlist that's called something like that, Finding the Job. Let me click it and see. Let's see. How to get take you. Okay, that's the wrong one. Is that the wrong one? There's a one that actually is specifically for billers. So, all right, give me a minute. Let me get this full screen again. Okay. Yeah, so I'll make sure that one, I'm pretty sure it's there's another link on these slides. I'll double check both of them before we load the slides for you guys. But that one, it will help you too. It has some specific things for receptionists, but there is one on our channel that is for our folks that are kind of in general looking to job hunt, okay? Resume templates. There are a lot of things to say about this. I believe that if you want to stand out, there are a lot of ways to do it. There's a lot of ways to make sure that all the past experience that you have had gets highlighted. It does require time. It does require the use of resources. I would use AI. Don't use AI and not review it. I would use the resources around you, like other people that you might have in your life that could help you review. And then we do have resume review, I believe, on the pro level and higher, so pro and mastery, that you guys can load your resumes. And if you don't know this and you have membership with Inlera, please know this, because we want to review more resumes. You can load your resumes to send to us, and we actually will review it for you. And so we'll go through, send you a video back, and then just kind of walk through what we think needs to be tweaked on your resume. So yeah, I mentioned this actually as the next tip. So yes, please make sure that you do a cover letter. It is different. Did you know that? Yes, it is different. Make it different. Make it different for each position. Please don't send your cover letter and not make adjustments to it. It doesn't have to be, 5 paragraphs long. It needs to be 1 to 2 little short paragraphs, one introductory, one of the meat, and then a little sign off. Nobody really wants to read a long cover letter, okay? But just make sure you're tweaking it according to the hiring team that you're applying for. Please practice interviewing. Lots of things to say about practicing and interviewing. We are going to start doing things for both interview prep, so doing gatherings to help do some role play interviewing together. So you guys actually on a Google Meet together, role playing and us actually interacting. You guys have to be willing to do these things virtually with us, people that you hopefully will start to trust. If you're new here, you may not trust me yet, but you need to start doing these things with folks that are kind of at your level if you are trying to really prepare yourself to get out there and be in the job market, okay? Because you guys, it is a little daunting for everybody, right? Interviewing is not fun. So if you can start to kind of work with those jitters and butterflies that you might get by just walking through it together, then you will make a huge difference in what's possible for you when you're sitting down in the interview individually or as a group, right? God forbid it's a whole group or a panel interview. Those can be very, very stressful. So let's walk through that together when other people can give you feedback and we can say, hey, let's try this. Why don't you say this instead, right? We can make suggestions. Cool. Research the type of environment that you want to work in. You guys, I love it when someone comes to me and says, I know I want to work for this practice with this size and this, or this specialty with this size practice or whatever. Like you need to do research around what's out there. And you have to ask yourself the questions of what you like, okay? The deal is this: if you have worked in a corporate setting before and hated it, you probably will not like working in a large hospital setting. It is corporate healthcare, all right? It is basically when you think about working in a large corporation where most people are in cubicles and, it feels the way that it feels, different than working in a practice where it might feel more like a little family where you guys go to lunch together and things like that as a practice, right? Totally different environments. One environment you might love, the other one you might highly dislike. So please ask yourself these questions and be honest about your answers, because what will inevitably happen is you will put yourself in an environment that you dislike and then quit. And that's not what we want, right? If you're going to go through the time and the effort to get hired in a job, let's get you in the place where you're actually going to be happy, okay? All right, let's talk about exploring software training. So there's some places, both in here on YouTube and other places, that might have glimpses into software. You might be able to get a sense of what happens in bigger software. If you know you're going to work in a hospital setting, and let's say you want to work at your local hospital, like ask the people, what software do you guys use in the hospital? Like, I'm curious, like I'm trying to get hired. Like you can ask somebody in the hospital. Like it's not like something that we're not allowed to answer the questions to in the healthcare system. All right. So if you want to get hired somewhere in particular, just ask the questions, right? Send your resume. Consider doing things like hand delivering them, and then make sure that once you apply that you follow up. All right. When I say hand deliver, I don't mean like, go to a whole nother state if you're working in another state. No, I mean like if you're looking to work in your local hospital, your local practice, potentially something easy for you to do would be to walk in and hand your resume to the front desk person and say, hey, I'm looking for a position. I have experience in your specialty. Can you give this to your hiring manager? The person at the front desk may not know anything about whether they're hiring. So don't force them to answer the question. They are doing a lot. Their day is full. Make sure you're mindful of the times that you're going. Usually the least busy times in practices are kind of just before lunch because they lighten the schedule at that time. So sometimes around 11:30. And then sometimes, and I say this, sometimes towards the end of the week after lunch, all right? Because again, some people lighten the schedule, all right? Other tips. So using clear formats. Please keep it simple. Make sure that you're highlighting things that are transferable. There are a lot of things that can be transferred from other industries. Include relevant work that you've done, coursework, certifications, especially if you have not only, but mostly done that, right? And you have transferable skills, but you've done things like you've taken courses with us, you've watched every single YouTube video, you can actually say that you've, ingested lots of, variety of training, and perhaps there's been some hands-on experience because you went to a software. There are some free online medical billing software out there, by the way, that you can download and actually install. As a matter of fact, you can even get ones that are like trials for most systems these days that are online, and just keep it for the trial period and cancel it. So, a week or 2 weeks or whatever, and just, let them know that you're just shopping around for medical billing software. And like, they might start marketing to you, and just tell them either I don't have a company or I've decided not to open a company, whatever you want to, say, but to get them off your back so they don't keep circling back with you. All right. If you're trying to get hired by an organization. But there are a lot of software companies that have the ability for you to get in there and manipulate information just by kind of clicking around. All right. And getting somewhat familiar with the different menus and things like that. Okay. Make sure that you are using action verbs. So anytime that you are mentioning rates of success in any area, if you are mentioning things like your collection rate, your first pass rate, if you are mentioning things related to your key performance indicators, those KPIs, things that you might have been responsible for in other places, those are all buzzwords that we are like, oh, they know what that is. Yes. Like we hiring managers get excited because it's not something that you have to explain somebody. Unfortunately, there's just not enough consistency in the training that exists out there. And so it is helpful when someone is familiar with those things. Make sure that you're including things that you're doing. Even if you have volunteered time by being an intern somewhere, please make sure that you're including this. And my friends, if you are interning, please treat this like this is the most important volunteer work you will ever do, because that person that is spending the time, they are spending time, even though they are not paying you. There is a lot of time and effort involved in training someone and having them intern. It is actually something that a lot of billers and billing company hiring managers don't like to do, because it really is kind of a gamble on whether you get someone who is devoted. But if you can prove yourself to be someone who is willing to make it worth your time, one thing is possible: you might be hired onto that company. But the other thing is more possible, which is really vital, is they will write you a letter of recommendation, and they will be there to be a reference for you. So please treat it like it is the most important volunteer work that you will ever do in your life, because it is, all right, if you're trying to actually be successful in this field. Other things that you want to do is actually look at the job descriptions and the listings and make sure that you're pulling in keywords to your resume, okay? So here's the deal. Here's the ways that I want you to be looking for landing your very first job. So first thing is that you actually want to look for positions that you're going to get on the job training. So there are some places that are going to say that we are looking for an entry level medical biller that is willing to be trained or willing to be introduced to said concepts or sent for training or might have access to a certification training that we provide in-house. There are some billing companies, especially larger revenue cycle management companies, that have whole departments that are job and professional development oriented, okay? So they bring people on, sometimes even our high school graduates, right? And I said that, yes, high school graduates on, because they might have taken some sort of like high school training program or something like that with this company. And they know they're going to be providing them with training in-house. So they have whole teams devoted to that, all right? So look for those. These are some of the best places to go to. I know that the mixed feedback around what's possible with Indeed and LinkedIn, it really depends on what you're looking for, but please don't look at 5 jobs and be like, there's no good jobs out there. Like, you must devote adequate amount of time to actually be researching and job searching, okay? And don't apply to 4 places and be like, I've applied everywhere, no one's responded back. My friends, if you really want to get the job, you're going to need to do the math, all right? So here's the deal is, let's say, like, you know that you have sent 100 resumes, and I'm not joking. Make a target that is clear and set a goal. It says, I want to hear back from 10, right? So if you know that that's the number that you're looking for, okay? You're looking for a very specific target, right? You're going to submit until you get to that number, all right? Until you hear back from that number of people. All right. So I don't care if you send 100 or 500. If you haven't heard back from the 10 that you said you were going to hear back from, then you need to keep sending. Okay. You need to keep applying. So persistence, remember the questions. Are you persistent? Are you patient? All right. You've got to be that first. Otherwise, maybe you're looking at going into the wrong industry. Okay. All right. Make sure you take additional training. The deal is that not only will you sometimes obviously, develop more skills and have more information put in your resume, but it also might give you more opportunities for hands-on experience, because different programs offer different things. So there might be places where you actually get introduced to opportunities from within that training group or that training program. All right. And then think about applying to medical billing companies and directly to healthcare practices, because the deal is that looking at Indeed and just, submitting resumes through there, like hiring managers, and I speak from experience, like we get hundreds of resume responses, and truly it is exhausting as a hiring manager to have to thumb through all of them, to then sometimes get like a small percentage of success in the people that are applying for the right positions. All right. So if they ask for prerequisites, they ask for specific requirements in their questionnaire, don't send the resume if you don't fit the bill. If it says have at least 5 years of experience and you're brand new, don't apply, because you add to the problem, which is no fun. But the main thing is that it can be exhausting for hiring managers. And so know that just because they didn't respond to your resume doesn't necessarily mean that it has anything to do with you. It could mean that they just got tired. They just got burnt out from looking at resumes. And so you going and hand delivering or applying by reaching out to the company, if the company has their information listed, and a lot of them do, where they list their companies, you can follow up with their departments and say, hey, I sent my resume and I want to follow up. By reaching directly out to the company, you can also do that through the program, through Indeed. Right? You guys have no idea, but really, truly, the smallest percentage of people would actually circle back after they sent their resume the one time, like the smallest. And those guys, those folks are the ones who top of mind. They come to mind faster. Okay. All right. Who do you know? These are really important things to know. I'm not going to read through this whole thing because we are past time. Joining groups, attending in-person events, getting experience and building your confidence, because sometimes the reason why we don't want to sit down for an interview, even though we say we want the job, is because we aren't confident. It's kind of a limiting belief, or some way that we hold ourselves back, basically, because we don't have the confidence. But there are a lot of ways through our community and other places like LinkedIn and Facebook, including our Facebook group. If you did not know this, should already be in the description box somewhere. We have a Facebook group called the Medical Billers Network. on Facebook, and there's a couple thousand people in there. There are always people networking. Please don't just go out there and just be like, I'm looking for a job, whatever. Like, be more mindful. Look at the posts and engage with the ones of people that are asking for help, because there are people who are asking for support, meaning like they're looking to maybe have someone help them with a project or hiring someone. So do that first, make yourself known. And then at some point you might actually say, hey, this is my experience. This is what I'm doing. I would really love some advice on helping me get a position. Let people chime into that. Like, actually start to develop relationships with people in the group first. Then you can be like, hey guys, you know me. I'm looking for a position, right? Like, some people go in and they're like, what is that called? Incognito, or like, it's like they're not even people. Like, you can do a anonymous, that's what it's called, an anonymous post in the Facebook group. And then we're like, hey, I'm looking for a job. And they're like, nobody wants to connect with someone who they don't even know who it is. That's the first thing. Like, don't post anonymously unless you really have to hide your self because of a position or whatever you currently have. But don't post anonymously if you're looking for a position, and then try to build connections and relationships in the network first. Because people see you active and they get curious and they're like, oh, they seem like they're determined. They keep engaging, right? In-person and virtual events are really, really helpful. Like, we even have, and I didn't put that up here, our medical billers meetups. We are going to start having our virtual networking events here shortly. So we're having medical billers meetups and virtual networking events. These are only opportunities. They're made to be opportunities for you to only do things like connect with people and get to know people, build a network of people, starting to build professional connections, even if you are brand new and have zero idea of anybody in your area or industry, in your local area in the industry. Okay. Consider working. We talked about this already. And then there might be some opportunities on places like Upwork, which is like a freelancing site. Okay, you are always making an impression on people. And I put this coffee shop thing is because if you're in job searching mode, then literally every interaction matters. Every interaction matters, okay? Like, I don't care where you are. You could be at the coffee shop. You could be in the elevator going to your doctor's office. Like, you have no idea who is around you at that moment and when you're going to meet these people that you need to know to help you get into where you want to go. All right. So please make sure that you are cognizant of how you present yourself and who you are in all places and spaces. If you really care about making this possibility for you and getting yourself into this career, then you must be ready to make a lasting impression on anybody you interact with. Okay. Okay. Common myths. We are about like 10 more minutes, maybe less. I'm not going to read through all these, but I want to just dispel some myths. So, do you need a degree? No, you don't need a degree. Hopefully we've covered that a little bit. Medical billing, the code is the same as medical coding. You hopefully know the answer to that already. If you have certification that guarantees you get a job, definitely not. Nothing guarantees that you get a job except for you being resourceful and doing what's necessary to get the job. We talked about some of those things already. All right. Medical billing is an easy work from home job. You guys, I hope I've not given you ever the understanding that medical billing is easy. It is not necessarily the hardest thing you'll ever do, but if you have never worked in anything in healthcare, it might be quite challenging. Okay. So it's important that you have the skills that we talked about already. It's important that you match yourself up with the role, like we discussed earlier first, so that you can have at least the foundation of something that makes this job easier, we'll say. Okay. All medical billing jobs are remote. Definitely not. Many companies require you to be in-house. All right. You can start your own billing business right away. Here's the deal. Yes, freelancing is possible. If you're confident and you're go-getter, you can pick up clients. We have someone in our inner circle who did just that, picked up client, zero experience. And you just gotta be hungry, as I say. You gotta be ready, okay? All right. So you don't need to learn you don't need to learn about insurance policies. You will need to. That's it. I'm just gonna say that. You will. So please don't go into this like, it's fine. I'll just get in and don't have to worry about, learning anything. You will always be learning. This is part of the nature of this particular industry because things are always evolving. All right, mistakes. I'm going to just read the headliners. You can look at the details when you get the download. Not getting hands-on training, skipping over resume optimization like we talked about briefly, not practicing the interviews, not making yourself active in these groups. Like I said, joining the groups is fine. Joining it is not going to get you communicating with people and connected. You've got to be active. Please don't underestimate learning curve. You've got to be willing to learn. Not keeping up with industry changes. Like, you must recognize, if you want to be resourceful, you want to be effective, you want to do a great job, that you have to be willing to keep up with industry changes in what's happening in insurance carriers, as well as what's happening with coding if you're looking at going to a specific, in a particular specialty. Focusing only on certifications and not really thinking about the skills and the mindset. If you have not checked out our mindset challenge yet, please do. It's one of the last videos. The whole thing is free. You can go to Inlera right now and actually enroll in the mindset training. My friends, most of what we do when it is new, the thing that's holding us back, the only thing that's holding us back is our mind and the decision to actually get it done. So mindset is everything. And so I want you to be thinking about where your mindset is right now. I want you to be thinking about, one of the last videos we did for members is also a discussion about mindset. And, we oftentimes can find ourselves in a role of, in a place where we feel like the world is against us, but it's because it's our head, our mind's telling us that, like, nothing is working in my favor. That's all coming from your mind. So I want you to be thinking about the importance of mindset, and then you marry that with skills, right? And we talked earlier about technical and soft skills, recognizing what you have in this moment, okay? And assuming medical billing is a fast-paced job. And so what is this? Assuming medical billing is a fast-paced job. Fast-paced? I don't know if this is written right. Yeah. Oh, yeah. Well, I guess it is. It's not my favorite crafted sentence, but it is. Okay, medical billing is fast-paced. It is not like receptionist in the sense of like things are happening and then you're kind of wrapping up stuff. Medical billing, lots of things happening, but there are things that we need to be super hyper focused on, because there's when we're in those moments of, let's say, payment posting or on the phone with an insurance to be able to have a claim reprocessed, or trying to check claim statuses online. All of those things require hyper focus for us to be present. So even though we'll be variable and things are shifting throughout the day, it's not necessarily going to mean that we're going to be kind of doing the octopus thing that happens with our front desk often. All right. In summary, how do you get started? You got to find the job. And I'm pretty sure this one hopefully has the right link. Let's make sure. And it's got the same one. I'm going to fix it. I think maybe that's the right one, and I'm just thinking that's the wrong one. I'll have to look at it closer. All right. So make sure that you're working on things to help yourself stand out. We talked about that. Oh, and create a LinkedIn profile. I'm sorry, I didn't mention this in our other list. If you're not on LinkedIn, please get on LinkedIn. If you don't like taking pictures, please still take a picture. Like, people really drive me nuts with this. Like, if you want to be in an industry that is human interaction, meaning you aren't just by yourself in a room with like books, you're going to be interacting with people. You need to actually be willing to let people relate to you and connect with you through seeing your eyes. And that is how they do that. All right. One of the fastest, easiest ways to stand out on your resume is to put your picture. Sounds weird to some people. Put your picture on the resume, because it is harder for people to throw away things that have people's faces. Kind of weird, but that's real. And also it allows someone to actually connect with you without even seeing anything on your resume. They're like, oh, you look like a nice person. Or like, oh, this is very friendly, or whatever. Like that, it happens. We immediately establish rapport with a picture. All right. Happens to you guys all the time on social media. You don't realize it, but you're requesting people and connections with people because of their pictures. All right. So network with people. We talked about that. Okay, who are we? We talked about this at the beginning. We do education and training. If you are not subscribed, please consider subscribing to YouTube. If you're watching this as a replay, I'm going to just mention a couple of things. We have membership here on YouTube, which gets you access to some other live streams and things that we do. And we also have a full program of services, of courses, as well as other things that we do. Our focus with Inlera University is to make sure that we help to make you guys more knowledgeable so that we can be able to watch healthcare improve, right? So you can read this. So we're going to help you achieve financial freedom and personal fulfillment in healthcare by providing you with knowledge, accountability, and support. So our desire is to do this by way of supporting you, because that downstream impact is improving healthcare. And when we say not just supporting you by getting you training, all of that, I have myself and my team, because we've got a whole team of people now, people that are creating other programs for us as well. I'm really excited about that. But my team is really committed to the same goal. We are all focused on alleviating the stress and confusion in the business of healthcare so that we can improve the delivery of patient care. That matters to us. We want our patients to have the best experience. That is something that is a common denominator for all of our programs and the people that are involved in Inlera University. And for that reason, we look to find people like you, hopefully, out there that are really fired up to do that, to improve the delivery of patient care, because we are all patients. Our loved ones are all patients at some point in life. So for us, it matters because we want to have this positive and better impact and outcome for our patients that are being cared for in this moment. And when we are cared for, or when our loved ones are cared for down the line, we can expect the same. So let's hope to revolutionize healthcare by actually bringing people in all areas of healthcare that care. All right. Hope I said a lot. Okay. I hope that communicated that well, because I want you guys to understand that I'm not just about like, hey, let's just teach you guys what you want. I actually want people who want to do a great job in healthcare for the ultimate goal. So this is what our programs look like. This is a subscription model. We are very focused on making sure that we provide you with access to the things that you need by way of our membership. So you can see, if you've gone to some of our courses in the past, you may not realize that our courses are now underneath this mastery level, all included. So all the mini courses and the programs, and we have future programs that are being released here in the next couple of months, including our healthcare leadership training program and our receptionist training program, which has shifted a lot because Felicia, who you guys might know, is actually the one who is crafting that program, and she is doing a phenomenal job. I'm really excited about it. But those programs and other courses that are on our channel, including on our training platform, including things like one-on-one coaching. Once a year, you get one-on-one coaching session included in Mastery. You also get invited to the different events, and that starts at pro level for a lot of the events that we have, our monthly training and development and things like that. So you pay $69 for a membership, and it's all access. All right. Everything's included. So you log in and you'll see all the courses right there. All right. So my friends who are confused about what that means, it means that the programs that we have are included. The only one that's not included under Mastery, and you'll notice this, is the actual certification boot camp, because it's a little different structure. It's very hands-on. It's a coaching program. I'm sorry, two coaching programs that are not included are our medical billing business coaching program, which is called the Inner Circle, as well as the CPB certification prep. Those two are not included, and they will not be included because it just requires so much time and energy from us. And Inner Circle is not open until October, the billing company training program. However, let's say you don't want to do membership just yet, you can actually book, and there should be links below that refer to the booking links to be able to book sessions with myself and Felicia as well. All right. So any questions that you guys have about the membership, please do let me know. And as I said already, the action plan, it says download it today. If you're watching this, anything beyond March 16, 2025, that action plan is already downloadable. You can access that as well as the recording for this and other things if you have membership to Inlera University, whether on YouTube or on our platform. But like I said, I'm going to make it available for 2 weeks. So my friends who are interested in going to the site, you can go there tomorrow. I'll make it available on the platform for 1 day. I mean, for 1 day, for 2 weeks tomorrow, 1 day from now. So so it should be available if you're watching it. Q&A. Okay, we had some questions roll in. Let me see. Oh, we answered this already, hopefully, I think. We do. We offer resume services, resume review services. That's included underneath the pro level. So essentially you get pro and above. You get access to a module that says resume review, something like that. And you are just uploading your resume to it, and then we record a video and we'll send it over to you to give you feedback. That's at least the structure right now as of March 2025. That might change down the road as the memberships grow. Obviously, when we have hundreds of you in the groups, then we might have to shift the structure a little bit. But our desire is to always be able to give the resume resume review underneath one of our memberships for free. All right. So yes, I've heard, oh no, we did this one already. I'm sorry. I skipped over your question there. Soap operas. Yes. Back in the day. That's so funny. You're so welcome. Yay. I love it. It's hard to break into medical billing without a background in it. So Heck, thank you so much for that. So it is true that and it's not necessarily about a background. Like what it is that us hiring managers, we don't like to feel like we are kind of starting out with someone who does not have the desire to learn, right? So if you haven't done things to develop yourself and get yourself as much access, hands-on training, and skills to be able to make yourself marketable, it means that if we bring someone who has very kind of entry-level experience or zero experience in, we're going to be the ones who are investing time without them showing and proving to us that they are able to and willing to learn. So I know I expressed that a little bit earlier too. So it is really, really important to understand that there is a difference between companies who require experience and there are companies that do not require experience. And I didn't mention this in some of our titles, but if you're like entry level wanting to get into the industry, you can start entry level by way of front desk and then applying from within, which happens with larger organizations. Very often they hire from within the organization. And then also you might start with an assistant level. There are often billing billing assistants, so medical billing assistants with an S at the end and not a CE, but the people who are hired with the purposes of being supportive to our medical billers, the certified billers or otherwise. All right. So that might be a role to be researching as well. Yeah, I'm glad you liked that, Dorothy. Thanks for being here. Yes, I'm curious about all the software. Oh, sorry, let's see. Curious about the software, and it seems that most people will have to learn a software, but they didn't use before. That is real. So that's why I say that it's not necessary for you to have like software training. I just want you to start getting familiar with different systems and how to kind of get in and out of a software, like where to go to a patient account for looking for demographics, where to access the documentation if it's accessible in that software, where to look at claims and any information about claim statuses if that's possible in the software. All right. And if you look at the software walkthrough video, it will help you understand kind of the general feel of a system and a medical billing software. And hopefully you can kind of take that and then you go to like I said, go to the medical billing software demos, free medical billing software, all of these terms you can Google and look for medical billing systems that you can get into and play around with. And how do you get into them? Like some of them have questionnaires. You just say like, I'm looking at starting to freelance or whatever. And like I said, they might market to you. Just know that, you can always take yourself off of their list. Just tell them to take you off. All right, cool. All right, you guys, it's 1:00 here for me Eastern time, and I have not broken my fast. So I do intermittent fasting, and I'm starting to get dizzy. So we're going to wrap this party up, but I am excited for my folks who are breaking into billing. What I need to know from you, I have my question to you is, what else do you need to know? What else are you wanting support in? And please let me know if there are things that I didn't cover in today's webinar that you want to learn more about. So without any further ado, thank you all for being here on Casual Sunday. I hope you're having a really beautiful day and enjoy the rest of your weekend. And I will see you again in another video. Take care, friends.